Good evening, all of you. Welcome to the Pranayama session. So before we start the session, I would like everybody to mute your audio. Kindly do not on the audio, it will disturb the continuation of the Pranayama. So today we'll be doing Kapalabhati and Ujjayi Pranayama. So first, sit straight in a comfortable position. Any questions we'll answer in the WhatsApp group. So right now in the middle of the pranayama, kindly don't ask questions. I will answer all the questions in the group. Okay. Now sit straight, form a namaskara sthiti. Take the thumb towards the chest center. Forearm parallel to the floor. Close your eyes gently. Slow, soft breathing. Chant Omkara once, and those who know the Pranayama shloka can chant with me. Pranasthidam vashe sarvam Tridiviya pratishtitam Madeva putran rakshasva Shrischa pragnascha videhina iti. Welcome all to the pranayama session. So we'll start off with a regular diaphragmatic abdominal breathing. So keep your hands in chin mudra, keep your spine straight. Those who are sitting on a chair, come away from the backrest. Don't rest your back because you go to a sleep mode. Close your eyes gently. Slowly inhale. Feel the abdomen bulging. Slowly exhale. Feel the abdomen contracting. Inhale. Exhale. Inhale. Observe the mind is concentrated on the breathing. Exhale. Inhale. Exhale. Gently open your eyes and keep continuing this breathing. This is a regular breathing pattern. So before pranayama, some rules. You should have had your lunch, dinner 4 hours prior. Okay? So if you want to do in the night, 3 to 4 hours prior, you should have your dinner. So your abdomen, stomach should be quite empty while doing any kind of pranayama. Because it is just a simple example, you're on a mobile call and somebody is in front of you and you're talking. The person is talking to you, so you are listening even to the mobile call and the person talking to you. What is the best thing you can listen? So
The
both
sound not clear.
both gets mixed up. The same way when you have food in the stomach, so the digestion and the breathing pattern both gets mixed up. So you can't do a very good breathing, nor digestion also will not happen for the food taken. That is why our stomach should be empty while doing
Louder, please, madam.
quite loud, sir. I think it's in your system. You should increase the volume.
कर दिया.
So Kapalabhati means Kapala means skull, and Bhati means cleansing it. So we are cleansing the skull, we are cleansing the facial muscles, and we're cleansing the nerves and the brains, releasing the toxins in the brains. Okay? So who all shouldn't do it is the first question. Those who have had hernia operation, those who have had a pacemaker, then those who have stunt, slip disc, those who are pregnant, and those who have peptic ulcer or any abdominal surgery. It has been in the recent time. Those who had any abdominal surgery, and ladies, during your menstrual cycle, you shouldn't do this. Okay, so those who have had abdominal surgery, after 6 months, you can start off and ask the doctor's permission to do the pranayama. So this is the don'ts. Who all shouldn't do this pranayama. Then this is very good for those who have low BP. And those who have hypertension and those who have a heart problem, they can do this pranayama, but there's a different method. So I should teach the regular method, and for those who have hypertension and heart problem also, I shall teach the method. Okay. So first, take your right palm and keep it on your abdomen. Take your right palm, keep it on your abdomen. So you should inhale and expel the air forcefully from the stomach. The air is not in the stomach, but pressure should be from the stomach to expel the air from the lungs. Okay? Inhale, the stomach is bulged. So, complete exhalation, forceful exhalation should happen in this pranayama. So, when we do this pranayama, you should inhale once and continuous exhalation should happen. Okay? This is for normal people. So, I shall show the normal method of Kapalabhati. You can keep your stomach, hand on the stomach and do that first. But before that, I shall show you, then we'll start together. Okay? Inhale. At the ending, you should do a long exhalation. Okay? And stop the pranayama. So, how many times should we do? Initially, if you're just starting off doing this pranayama, we should do it for 12 exhalations. Okay, we should do it for 12 exhalations. And now, for those who have hypertension and those who have heart problems, the method is you're going to inhale, expel the air forcefully, and breathe normally. Okay, just observe me once. You should inhale. And breathe. Exhale. Inhale. Inhale and exhale. Inhale. Why we should do this is because if you do it continuously, for those who have issues, the blood pumps too much to the heart. So the pressure is more. So those who have hypertension and heart problem, they should do it slowly, giving gaps but forceful exhalation. Okay, so the advantages of Kapalabhati is, as I told you, it's for the skull, for your facial muscles, and those who have any mucus problems, okay, and those who are undergoing depression, it increases the heat in the body, okay, to increase the heat in the body, and those who have low BP, so it is very good. And after this, it also relaxes your mind, relaxes your body after you finish the pranayama. So we shall do 12 Kapalabhatis in one set. Those who have hypertension and any heart problem, without pacemaker or stunt, do it 5 times as I have shown you. Okay, so 12 times we will do, then we will exhale continuously, then normal breathing for 3 times, normal 3 times breathing. Then again we shall do one more set of Kapalabhati. Okay, sit straight, keep your hands in chin mudra, shoulders relaxed, neck muscles relaxed. Those who want can keep your hand on your stomach to observe the abdominal movement. So you're going to expel the air continuously. What happens to the inhalation? People ask. It will voluntarily, you will be inhaling little amount of air. Okay. Now close your eyes. Inhale slowly. Exhale, normal breathing. Inhale, diaphragmatic, abdominal breathing. Once again, we shall do it. Inhale. Exhale through your nostrils. Slow, soft inhalation and exhalation 3 times. We shall do it again after 3 breathings. Inhale. Exhale. So this is Kapalabhati. So those who are starters can start giving 12 counts, do 12 forceful exhalations, give a gap of 3 normal breathings, and again do another set, and again do another set. So how many sets can we do this? You can do 100, 108, depending on your practice. Okay. So the wrong method of Kapalabhati also I should tell you. So there is no movement of shoulders. So you shouldn't expel or no movement, disturbance of your upper body should not be there. So this is a wrong method. And your exhalation of the air, it should be in one pace. It should not be forceful ones, slow ones, forceful ones, slow ones, like this. Okay, don't break it up or don't. So start off with 12. If you can't start off with 12 exhalations continuously, do only 10. So depending on your capacity of the lungs, start off. Then slowly the lungs will build up, strengthen, and then you can increase the count. Don't be in a hurry to do 36, 50, 60 at one go. Okay? So you can do 108, 200 according to your capacity. But preferably start off under a proper yoga guru so that you will do it properly. So sometimes if you do it in a wrong way, there will be a little headache, there will be a little giddiness, and you will feel a little giddy after you finish the pranayama. So that's why I'm telling you to start off with 12 exhalations. Okay? Now, we shall do Ujjayi Pranayama. We finished with Kapalabhati Pranayama. We shall do Ujjayi Pranayama. Ujjayi means flying up. So when you inhale, your abdomen bulges. The diaphragm pushes because the lungs is filled with air and the diaphragm pushes down, so the abdomen bulges. While exhaling, the air comes upwards. So the coming upwards should be soft and slow. In Ujjayi Pranayama, we are contracting our throat muscles. So to expel proper air and strengthen the throat organs. Who all can do Ujjayi Pranayama? Everybody can do Ujjayi Pranayama. And the benefit of this is those who have stress, those who are in depression, those who have throat problems, then those who have pulmonary disorders, BP, all it will help to reduce your problems. But with the long practice, your problems will also vanish. But it should be done in a proper way and continuously. If you say you did today and do again next week, there will be no advantage of the pranayamas. Okay, it should be practiced every day in a methodical way. So in Ujjayi Pranayama, there are 4 ways. Initially, I will be teaching you 4 ways. So the first method is you're going to inhale slowly. While exhaling, you're going to exhale deeper, slower and deeper. Just like you're climbing down the stairs very slowly. Okay? You're climbing up fast, but you're climbing down the stairs very slowly. So your exhalation should be as slow as possible. Okay? Your inhalation should be normal. Your exhalation should be slower. Okay? We shall do that first. That we shall do it 4 times. The second pattern, we will continue the second pattern after we finish the first Ujjayi method. The second Ujjayi is you're going to inhale. So you're going to climb the steps very slowly. You're going to climb the steps down faster than you're climbing the step up. That is, you're inhaling very slowly. You're exhaling in the normal pattern. Got it? So we'll do that also 4 times. So your first method, you're inhaling normally, you're exhaling slowly, as slow as possible. Okay. Your second method, after you finish it 4 times, the second method is you're inhaling very slowly and you're exhaling in the normal way. Let's start. Keep your hands in Chin Mudra. Close your eyes gently. Do not press the eyeballs. Do not contract your eyebrows. No wrinkles on the forehead. Normal breathing. Inhale and exhale. Now, we should start the first pattern. Slowly inhale. Exhale slowly and deeper. Slower than your inhalation. Your complete sense organs should be towards the breath. Inhale. Exhale slowly, softly. Inhale. Exhale. Inhale. Now the second Ujjayi Pranayama. Inhale very slowly. Exhale normally. Inhale slowly. Inhale slowly. Inhale slowly. Normal breathing. Do not open your eyes. Just enjoy the breath. Enjoy the peacefulness. Feel and observe your breath. Now gently you can open your eyes. So this is the first and second method of Ujjayi Pranayama. Now the third and fourth method we shall do. So when you do this third and fourth method, we are going to contract our throat muscles, and through the nostril we are going to make a sound of hus sound. Sound will be produced through the nostrils. Okay? So when you do this, you are going to inhale deeply and exhale deeply. So that is why I made you do the first two pranayamas, Ujjayi 1 and Ujjayi 2. So the Ujjayi becomes more better and efficient. Okay? So just observe me and listen to the breathing pattern. Then the next, that is the fourth method, we are going to use a bandha. Okay, Jalanda. You're going to lock the chin to the collarbone. Anybody having issues with your neck, you can do with your neck straight itself without touching the chin to your collarbone. Okay, those who can't reach the collarbone, you can just bend your neck as much as you can. Okay, don't force it, then you'll be straining the neck. Instead of observing the breath, you'll be observing the pain. Okay, so I shall just do both the methods two times. Just listen and observe. Close your eyes. So a slight sound similar to the snoring sound in the throat you can do. But don't do it too louder. You should be aware of it. So because why I'm telling you to make a slight sound is so that your awareness, your mind is towards the breath. Okay? So we shall start. Sit straight. We shall do it five times. First, with your neck upright and doing Ujjayi Prakara 3. That is the main Ujjayi Pranayama. 5 times. And then I shall take my chin down and lock it towards my collarbone. Those who can, just bend your neck. Okay? Sit straight. Close your eyes. Once again, take all the sense organs inwards. Skin, feeling the breath. Ears, hearing to the breath. Eyes, watching the breath. Throat, feeling the air. Inhale and exhale and start. Without opening your eyes, lift your head up. Observe your breath. Observe the state of your mind. Observe the calmness. Observe and feel your breath. So Ujjayi Pranayama helps for the throat issues. You have issues with your voice, asthma, depression, even for the teeth, it is good. Okay? So all the pranayama, if you practice in the morning or in the night, early morning is the best because your stomach is empty. But if you can't practice in the morning, practice it and give a gap, see to that there's a gap between your lunch or dinner or your snacks, at least 3 hours. And then do the pranayama. So before you do any pranayama, just do a little warm up so that the body is ready. And then you can start off pranayama. If you feel tired or you just want to lie down after the pranayama, you can relax in shavasana also for a few minutes and then come up so you're refreshed even more well. Okay? So the questions, any questions, you can ask in the WhatsApp group. So every month we will be doing 2 pranayama so that you practice well. So this month it was Kapalabhati and Ujjayi pranayama. So next month there will be 2 more pranayamas. So that by the next pranayama session you should have practiced Kapalabhati and Ujjayi well. Okay. Now form a namaskara sthiti. Omkara. Asato ma sadgamaya tamaso ma jyotirgamaya mrityorma amritangamaya. Om Shanti Shanti Shanti. So this month end, again we'll be doing Trataka session. Kindly attend and pranayama, please do it under the guidance of a good teacher so that you do it well and be healthy. Thank you.
Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Thank you.
Thank you, ma'am. We are expecting the next session soon, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Okay.
Thank you very much.
Thank you so much.